I'll make a presentation for both Plan International and the Save the Children. I'm Janet, the project manager for JOFA, sitting with Save the Children. So, answering the two questions on what has worked in Malawi and let me remove on what has worked in Malawi and to address child labor through mechanisms of social protection and case management. So in Malawi, child protection case management system has helped to identify vulnerable children in and at risk of child labor who are assessed at the individual and household levels and referred to relevant social services. Save the Children in particular uses a connecting model of case management, which promotes an integrated community-led case management system to systematically link vulnerable children to various types of social services, while also empowering the communities and families to be able to identify protection risks and be able to address the root causes. This was tested in Malawi during the COVID-19 pandemic, where over 1,700 children benefited from cash plus protection and education. And we also intend to adapt the same model to ending child labor. The Connect Plus refers they identify the children at risk for different services, and they are followed until the case is closed. There is also provision of economic alternatives to households that are at risk and those with child labor cases, where you link the vulnerable households to microcredit or loan facilities and bring the vulnerable households together in village savings and loan groups. There are also skills development for out-of-school children aged 14 to 17 years that are being provided by different partners. And there is also social protection programs by government, usually supported by partners. There are no specific laws that govern the social protection programs, except for the Constitution of the Republic of Malawi and Child Care Protection and Justice Act that you can refer to when it comes to laws. However, policies exist, such as Malawi Social Support Policy and Malawi National Social Support Program. These are set as building blocks of the country's strategy in the field of social protection. We also have the National Social Welfare Policy and the Malawi Social Cash Transfer Program Strategic Plan that are referred to. The strategic plan is running from 2022 to 2027. However, we also have specific guidelines for each specific social protection program that exists. However, within these guidelines and criteria, households with child labor cases do not directly fall under any of the criteria in all the social protection programs. Some of the social protection programs that exist within our country, we have the Social Cash Transfer Program, and this one predominantly targets labor-constrained ultra-poor households. And these labor-constrained ultra-poor households are defined as the households that have the ratio of members that are not fit for work to those that are fit to work. And unfit in this context, it means being outside of the economically active ages, below 18 or above 64, or having a chronic illness or disability. These are the households that are considered for social cash transfer program. We also have public works programs that provide regular payments to individuals in exchange for work, especially in public construction. And we also have affordable inputs program. And this one targets resource poor farmers in rural Malawi with specific attention to vulnerable groups. Selection is based on yearly updated farm family register, which is issued to district agriculture offices. Then we also have the school meals program. these target districts and schools based on indicators of food insecurity, poverty, gender disparities in schooling, education outcomes, and malnutrition. There are also disaster-responsive cash transfers. For example, the COVID-19 urban cash initiatives that was meant to mitigate the adverse impacts of the pandemic on livelihoods and basic consumption for poor populations in the urban cities, in our 4 urban cities. Then on what gaps exist and what solutions could we propose to strengthen the social protection mechanisms in our case, Malawi. Maybe one of the major gap is we have fragmented child labor data for decision making. Child labor monitoring system is yet to be developed. We do not have it working currently. And the child labor data is fragmented and is sitting with various implementers rather than the Ministry of Labor. And the data from the community is channeled through the 2 different ministries, that's Ministry of Labor and the Ministry of Gender, Social Affairs and Community Development, providing room for double reporting. The system linkages have not been fully harnessed. While the child labor issues sit with the Ministry of Labor, the mandate to carry out case management for child labor cases fall under the Ministry of Gender, Social Affairs and Community Development. So on the ground, you find a child protection worker that is working on all child protection issues, including child labor, but falling under the Ministry of Gender. While our line ministers who work on child labor issues is the Ministry of Labor. And again, social protection is often donor-driven and donor-financed and consists primarily of programs implemented on ad hoc basis. As a result, so as I said, social protection is often donor-driven and donor-financed. And under the current system, it is difficult for the government to oversee the sector as it relies on reports from implementers. And we recommend that government needs to review the national social support policy to expand coverage, inclusiveness, quality, and adequacy of the social protection system in Malawi. There is need to explore how to effectively extend the coverage of social insurance schemes to the informal economy, as well as an overall improvement in the accountability and transparency of the social protection programs. The cash transfer amounts that they are substantially small vis-a-vis the country's economic landscape. For now, people receive between $4 to $11. And when you look at the inflation rate of the June 2024, it becomes difficult to graduate participants because these amounts are limiting progressive development. Again, current social programs are deemed as tackling immediate relief rather than building resilience for families. Selection of the beneficiaries while using the Universal Beneficiary Register currently targeting of child labor and child-headed households in the government social protection is quite limited because they use the Universal Beneficiary Register with some specific criteria that do not attach to child labor households, constrained households, as well as those that are child-headed households.